All right, our next speaker is Dr. Gregory Tao, who is board certified in child and adolescent psychiatry, general psychiatry, and addiction medicine. As faculty at Columbia University, Dr. Tao conducts MRI research that aims to understand how the brain's neural systems function in individuals who abuse substances. He is involved with community groups in order to reduce the burden of drugs and alcohol on the lives of young people.
Thank you very much for having me here. I really appreciate it. It's quite an honor. So today I'm going to put my hat on as a clinician, as someone who sits in my office and sees a lot of teenagers in New York City. And I'm going to take a step back and we'll look at the overall prevalence of, so I'm just going to click on this. There we go. Next slide. Overall prevalence of substance use by youth in our country and the ways that it's linked to other mental health condition. And a really key message that I'd like to communicate is that substance use disorders don't travel alone. And dually diagnosed individuals or those with substance use and a co-occurring or comorbid psychiatric condition, such as mood, anxiety, and psychotic disorders, are more prevalent than we think. This is more the rule than the exception in clinical population. And for this reason, we can't turn a blind eye to substance use in mentally ill individuals and to other mental health conditions in substance-involved youth, as is often the case. Next slide. So this is the latest data from the Monitoring the Future study, which is a longitudinal study that's been going on for over 40 years at the University of Michigan, that queries 8th, 10th, and 12th graders, as well as college students, and asks them about their substance use. You can see that the lifetime prevalence of any substance use by youth is quite high, and it's around 50% for high school seniors, not surprisingly. I'm going to focus on four substances. The two most prevalent ones, marijuana and alcohol, and opioids as well. We do have a crisis, and e-cigarettes, because I've been seeing a lot more of this in my practice, and I just want to say a few words on this. I think it's quite important. So let's see. I think we skipped a slide. Can you take one step back? Oh, there we go. Thank you. So these are the most recent statistics for marijuana use in youth in our country. And you can see that in 2017, we see the first significant annual increase in 7 years across grades. So the researchers look at this data and they look to see if there's any changes from one year to the next across this cohort, across this population, that is statistically significant. They found that this year is the first time that there's an uptick. And the thought is that it has a lot to do, next slide, with the perception of harm. We know historically that perception of harm is inversely proportional to the use. So if we don't think something is a big deal and we're not concerned about it, the barriers to use are going to be lower. And we believe that these days the messaging around marijuana use is such that it supports these ideas of reduced harm, and it's linked to increased use. Next slide. Thank you. We see that marijuana use doesn't discriminate across socioeconomic conditions, classes on the lower right, and on the lower left across races. However, there is a disparity between, or a difference between boys and girls in daily marijuana use. So daily or near daily use of marijuana in boys is 8%, and girls is 3.6. So it's over 2 times more prevalent in boys, which is an important thing to note. On the next slide, we see some data from Monitoring the Future on alcohol use by youth. And we can see that the rates in both males and females have declined dramatically over the years. In 2017, relative to 2016, there's a bit of a plateau. So this rapid decline has halted. It's a little bit of a plateau. And the rates of boys drinking was historically much higher than girls, and the gap is closing now. In the next slide, I want to talk a little bit about vaping. I think we all walk around and see people in the streets using very large Baroque devices that emit steam and smoke. And over the years, these have gotten quite smaller. And now something very popular that I see high school students using in school, outside of school, in class, in my office, like this, are these little nicotine vapes. This one you might be familiar with. It's called the Juul, Juul, and it's very tiny. It's just this little thing that it's USB rechargeable, and you just plug it into the iPhone charger or your computer, and they come with these pods, and each pod is equivalent to a pack of cigarettes. And just kind of backing up, vaping is defined as use of any electronic vaporizer device to inhale nicotine products, cannabis products or marijuana products, or flavoring. There are people who just vape flavoring, and some of the tobacco products are flavored as well. I mean, there's creme brulee and bubble gum, and I think the latest craze is over the pineapple flavor. In the past year, 19% of 12th graders have tried a nicotine vaporizer, and 16% 10th grader, and 8% of 8th graders, which is quite high. It's something that I see a lot in individuals who would have never considered smoking cigarettes before. Vaping is very addictive. Vaping increases the likelihood of subsequent cigarette use. So it's almost like an introduction to cigarettes. It's an easy transition because it's nicotine as well. And it also, more vaping. Because the normal feedback mechanisms around vaping relative to cigarettes are not there. People stop after a few inhalations of a cigarette, a puff of a cigarette, or after one or so. With vaping, you don't get that same kind of feedback, the cough and all that, so people consume a lot more nicotine, so it's easier to get dependent. Male gender and marijuana use are associated with e-cigarette use in youth. And though vaping may be a harm reduction strategy or a smoking cessation strategy, because it's not, we don't know that it to be linked to lung cancer and a lot of the very negative health outcomes from smoking cigarettes. It can be a gateway to other nicotine use by many teens, and it's associated with concurrent and subsequent cigarette smoking. The good news is that cigarette smoking is viewed as very harmful by youth, and the rates continue to decline in 2017 to really historic lows. I'm going to just say something really quick about opioids. In this study and in some other national studies, it's hard to see an overall increase in the rates of use or reported use by opioid use by youth. And it may be that adolescents are affected because of the effects of opiate use on their families and their communities. And it's something that's just not borne out by these studies. That said, I see a lot of opiate using adolescents in my practice, and a huge problem is access to care. Because because medication-assisted treatment for opioid use is it's really quite a lifesaver, and it's not often available and researched and approved for adolescent use. So that's something that's a very important thing to focus on. I put the next slide up there just to show you that if we look at, have you ever used any kind of drug or even had a sip of alcohol at any point in time, to have you used in the past 30 days or in the past week, these rates go down. And because many people have tried drugs, but far fewer people use frequently and get into trouble with it. And how can we tell that someone has a problem? What criteria do we use to diagnose? In the DSM-5, which is the Diagnostic Statistic Manual published by the American Psychiatric Association, there are a few areas, a few domains that we look at or we analyze when someone comes into our office to figure out if they have a problem. One area is the loss of control over use. The substance is taken in larger amounts or over a longer period of time than intended. There's always a persistent desire to quit or unsuccessful attempts to cut down or control the use, and continued use despite having persistent and recurrent social or interpersonal problems caused by or exacerbated by the substance. The other day, one of my patients came into the office and she said that she's keeping the Juul pods and her boyfriend keeps the Juul just so they don't use. And then when they get together, they smoke over the weekend. The lengths they go to regulate this use. I noticed that I'm running out of time, and I want to just say a few words about comorbidity. Many people use over their lifetime. Fewer people have problem substance use. And then individuals with other psychiatric conditions, there's a big overlap, a very big overlap between mental health illness and problem substance use. It's possible that there are shared risks for psychiatric illness and substance use. There may be overlapping symptoms, which makes it very difficult to diagnose and treat. And in fact, in the presence of significant substance use, it's very difficult to make another mental health diagnosis, just because substance use problems are great masqueraders. Problem substance use predisposes to psychiatric illness, and vice versa. We also know that individuals who use substances make the treatment of other mental health conditions quite complicated. Substance use disorders affect the course of psychiatric illness, and vice versa. And there's a lot of recidivism in this population. How many minutes do I have? Okay, so if the organizers will make this presentation available to you, you can review some information about disruptive behavior disorders, such as ADHD, oppositional defiant disorder, conduct disorder, what they're about, how they're associated with substance use problems, mood disorders such as depression, bipolar disorder, and how they're associated with substance use problems, and some anxiety disorders such as generalized anxiety disorder, social anxiety disorder, obsessive compulsive disorder, and post-traumatic stress disorder, which we've heard about earlier, and the relationships between those and substances, as well as some psychotic disorders. And one thing that I'd note, we all know about the data where heavy marijuana use predisposes to youth having a psychotic episode. So in wrapping it up, what can we do about it? It's very important to increase the funding for education, to address knowledge, the stigma, prevention, screening, treatment, and research. I'm so delighted CHIP is funded, it's on its way. We also have in the works the 21st Century Cures, or the STOP Act, which secures funding for SBIRT, or Screening, Brief Intervention, and Referral to Treatment, which is an evidence-based strategy to identify youth at risk and get them the help they need. There's also a Youth Act in the House, which extends MAT, or medication-assisted treatment for opioid use, to minors, which is critical. And at the end, you can see a way to contact me should you have any additional questions. Thank you.